If your clinic mornings feel like a conveyor belt of my shoulder hurts and my back is tight and paperwork that never ends, you're not imagining it. Trust me, that physio grind, it's real. But it's also a sign you're stuck chasing symptoms instead of changing lives. Let's flip that. After 30 years in this profession, here's the uncomfortable truth. Burnout isn't about paperwork, it's about feeling like your work doesn't matter, and nothing reminds you of why you became a physio faster than keeping someone on their feet. So if you've ever wondered about balance exercises, you're not alone. And today I'm going to show you why fall prevention is physical therapy's hidden superpower, and how there's 3 simple tests and the thinking behind the real-world balance progressions that can change your career and your patients' lives. This isn't just another YouTube video to follow along with the balance exercises. There are enough of those. What you need are 3 simple balance tests that actually matter, and balance progressions that work in the real world, and the sensory and mental training your patient relies on to do well outside the clinic. While you're slogging through another post-op knee or tight shoulder or stubborn low back patient who skipped their exercises, the thing that truly protects independence is keeping people off the floor. Be the physio who makes a real difference. Before we jump in, a quick safety check. Check for red flags. Use your safety tools, a gait belt when things get wobbly. Stay close by. Position yourself below the patient on stairs. And if somebody needs a device, then give them a device. Right, let's crack on. Major idea number 1, simple, effective balance tests every physio should use. Physios are drowning in more than 20 validated balance tests. Add to that your mountain of paperwork, and it's no surprise you're left wondering which ones actually matter. I've been there too, but here's the truth. 3 numbers predict most falls, mortality, and independence loss. Miss them and you're guessing. Track them and you're cooking with gas. Gait speed. Time your patient walking 4 meters at a normal pace, no coaching, using their normal device. Slower than 1.0 meters per second indicates a high fall risk. Have this set up in your clinic. I usually sneak this measure in as they walk in from the waiting room to my office. Timed up and go, the tug test. Patient rises from an armchair, walks 3 meters, turns around, walks back, sits down. Normal pace, no coaching, use their usual device. Over 12 seconds is a high fall risk. Single leg stance. Patient stands on one leg, eyes open, hands on hips, no hopping, no arm flailing. Less than 10 seconds is a high fall risk. Test and retest every 4 to 6 weeks. Show your patients their numbers. Nothing fires people up like seeing their numbers improve. Yes, you can use a different test. Like I said, there are a ton of them. At one nursing home, we ran the Tinetti balance and gait test on every resident. Scores under 18 triggered their fall prevention strategies. But be sure to measure and remeasure to show progress. Insurance companies love these numbers. Subjective 0 to 10 pain scales can be wishy-washy, but these scores are rock-solid evidence. You've got the numbers, you've got the proof. Now your patient is looking at you like, what do I do now? That's when the real fun starts, turning those scores into balanced exercise progressions. Major idea number 2, 4 practical balance progressions your patients need. Physio school dumped a million balance exercises on us, but never showed us how they were related. Here's the way I've learned to think about balance. A progression is no different than adding weight to a strengthening exercises or choosing a heavier resistance band. It's just a simple overload principle. Make it challenging enough to matter, but not so hard that it's unsafe. Knowing when to progress is a bit of an art. I know that it can feel frustrating early on, but trust your gut. You've got more clinical instinct than you think. And believe me, I've pushed the progression too fast and watched patients wobble like a newborn giraffe. You learn to adjust and you get better at reading the moment. Keep the safety points from the intro in mind. Here are 4 balanced progressions your patient needs. 1. Progress the base of support. A normal or narrow base of support to kickstand, that's 1 foot 1 toe, to single leg balance. Notice how 2 leg standing blends into kickstand, which blends into single leg. Just get your patient to shift their weight and own each position. 2. Explore balance strategies. Originally from Nashner in the 1980s and popularized by Shumway, Cook, and Wollicott. Start with the ankle strategies and then the bigger hip shifts, hip strategies, and then the stepping to catch their balance. This is your mini lunge to safety. These are some real balance strategies that the body uses in real life. 3. Wean from support. From solid hand holding to fingertip touching to hover hands. In the real world, this mirrors that arc from a standard walker to a wheeled walker to a cane to no device. 4. From balance to power. Falls happen fast, so the training has to keep up if it's going to stay relevant. Start with slow, controlled movements, like sit to stands to standing foot taps to step ups. Once they're stable, add speed and power, faster reps, quicker taps, explosive step ups. You're training their ability to react quickly without cheating and maintaining good form. Is that it? Not quite. As I was writing this, I realized there's a fifth dimension of these balance progressions that we can't ignore. It's perturbations. Start with small disturbances inside their base of support and then move to perturbations outside their base of support and then add external perturbations. Okay, that's it. No fancy gear, no complicated protocol, just a progressive overload for real stability. And that's only the physical half. Your patient still needs the other half, that sensory mental side, or maybe we should just call it for what it is, the fear side. Major idea number 3, graded exposure to overcome patient fear, the sensory mental side of balance. Balance isn't just muscles. We know that, right? It's vision, it's vestibular, it's proprioception, and the brain that's terrified of falling. Fear shrinks patients' worlds faster than weakness ever will. For some people, their whole universe becomes the home, the grocery store, and the doctor's office. Or worse yet, bedroom, bathroom. Here's the trap. Telling someone they're safe doesn't really help. Never in the history of telling someone to calm down has anyone actually calmed down. Graded exposure is the fix, not reassurance, not a pep talk, not telling them to relax. Controlled challenge is the treatment. You're proving to their nervous system that their body can handle this fear and challenge. You scale the challenge gradually. A little wobble is good. Remember that overload principle we talked about? It applies here too. That wobble is the weight that the nervous system needs to lift in order to get stronger. If they aren't wobbling, they aren't learning. Just keep your hands ready and your setup tight while you push those limits. That's why I was reminding you about the safety considerations in the intro. In the clinic, this looks like 1, add a visual challenge. Eyes open to eyes dimmed or squinted to eyes closed. This is for low light and nighttime simulation. I wouldn't blindfold a patient. I think that's a little severe for me. 2, add a cognitive load. First, use an internal focus. Get them to think about their body awareness or movement or sensation. Things like shift your weight a little this way, or keep your stance nice and tall, or keep the movement quiet and controlled. I use this early on when I'm trying to clean up their messy movement patterns. Then shift to an external focus. Have them look at a target or aim for an outcome, because this lets their nervous system adapt and improve. And once they're handling that, you can throw in a distraction, add a bit of casual conversation, get them to count out loud, or eventually even a simple game of catch while they're balancing. 3, add real-world messiness. If they can only balance in a quiet, flat room with perfect lighting, they'll still faceplant at home on the grass or in the store. Start small and build. Every little win adds trust. Always match the challenge to their world, the surfaces they walk on, the tasks they do, the chaos they live in. You can use foam pads or thick folded mats to mimic uneven grass or sand or snow or thick carpets. Start with simple standing and then progress to small steps. You can add head turns while they're walking and standing to get them to scan the room like they're looking for their keys. That's the visual vestibular challenge. You can bring in loaded carries by having them hold a grocery bag or a laundry basket or even a tray of plastic cups, because that's the real life stuff that forces stability and awareness. You can add stepping over objects, cones, tape lines, or even a pencil on the floor to teach foot clearance and reactive stepping. Remember, a little wobble is okay. Progress your challenges. Small wins build momentum. Watch their eyes light up when they can realize, hey, I can do this. If you want a deeper dive, it's in my exercise book. Yes, an actual book with pages. Do you even read books anymore, or is it all just reels and shorts and TikToks nowadays? Once the body and brain are working together, the bigger picture clicks. Balance training isn't just a skill set, it's part of what keeps our profession relevant and our patients living on their own terms. Hey, look at you, you've made it to the bonus round. Bonus idea: why are you a physio? Why fall prevention matters in physical therapy. Fall prevention isn't a side quest. It's the heart of why you became a physio. Helping Granny get back on her feet again, getting the footballer back to sprinting again, that's real impact. It's not just giving them pills. And when you see that hip fracture kills almost a third of women and over a third of men within a year, the whole picture snaps into focus. And this is the part that stuck with me. In our clinic, we had a patient with a simple Fouche wrist fracture. It healed fine. We discharged her. 6 months later, she comes back with an ankle sprain. 2 years after that, she came back with a hip fracture. Same person, same balance issues. different presentations. That's when it hit me. This Fuchs to hip fracture isn't bad luck, it's missed intervention. And that's the story we're trying to interrupt. That's fall prevention. And the scale of this problem is massive. Falls hit about 30% of people over 60 years of age, and they're leading cause of injury-related hospitalizations in Canada. Balance impairments show up in about 75% of people over 70, and it's not just strokes and osteoporosis. It shows up with deconditioning, cardiac issues, post-op. One prevented hip fracture can save about $40,000 in direct costs and thousands of dollars in subsequent care. The real win here is your patient stays in their own home on their own terms. And that brings us back to the question in the title, why are you a physio? It matters. It matters every day you walk into the clinic and every time you help someone. That's why your assessment and your treatment matter so much. Be there for your patients. That sense of purpose is what keeps your passion alive when burnout starts knocking. Everything we've covered, simple measures, physical progressions, graded exposure, feeds directly into this bigger mission. Here's the key takeaways. 1. Physios are the best profession positioned to stop falls before they happen, not just cobble the pieces back together after the damage is done. Many physios get stuck trying to fix ouchy joints day after day, but your real superpower is keeping people off the floor and protecting their independence, seeing the big picture. That's the big win. Doctors are busy keeping patients alive, nurses are busy with daily care, OTs focus on ADLs. Physios are the ones that tie fall prevention together: exercise, gait, home safety, and functional progressions. 2. Build fall prevention into every plan of care. Sure, it's obvious for post-op knees or back pain, but even shoulder strains and wrist fractures. Remember the Fuchs to hip fracture story? Even shoulder strains and wrist fractures still need balance, power, and graded exposure. If you can't truly fit it into their current treatment plan, get their doctor to re-refer them for balance training or give them a self-directed balance program. 3. See yourself as a professional for patient independence. Physio isn't just hot packs, TENS machines, and exercise handouts. It's the thinking behind all of that. That's why I'm giving you the options for your balance progressions. You choose what's best for your patient today, and that'll be different tomorrow. That's what makes physio exciting. That's what keeps your mind in the game for the long haul. That's why I'm here, and hopefully that's why you're here too. Fall prevention is the quiet superpower of our profession. Measure the risk, progress the load, expose the fear. That's how you stop being a joint fixer and start becoming the physio people remember when it actually matters. So grab your gait belt, let's get going. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Another video for you to chew on right here, and by subscribing, you'll be part of a vibrant community that celebrates everything physio. Thank you.